Hello, today is Friday, March 18th, 2022, and I'm here with President Nez of the Navajo Nation. My name is Megan McGuire, and let's get started. So could you please introduce yourself and describe exactly what your job is, what your day-to-day looks like, President Nez?
Right, and good day to you, Megan, and the viewers out there. My name is Jonathan Nez, the president of the Navajo Nation. We have a large land base tribal nation, the biggest in the country, 27,000 square miles. We're in the four corner states, Arizona, New Mexico, Utah, and Colorado. We have an enrollment of Navajo members of over 403,000. And, we leadership govern the sovereign nation of the Navajo. And we also work similar to other presidents, prime ministers of countries throughout the world. So, being a sovereign nation, we're able to work directly with other tribal governments and international governments as well. So just like being a leader of a country, of a nation.
Okay, perfect. So what I'm going to ask then is, can you take us all the way back to December 2019? What were you doing, and kind of how did you, as president of the Navajo Nation, respond to the pandemic since then? Kind of just like walk me through the years since 2019 when COVID-19 emerged.
Well, in January of 2019, Vice President Myron Leiser and I were sworn into office to lead the Navajo Nation. And 11 months later, we got hit with a pandemic. Who would have known we would be governing most of our 4 years through a pandemic. And, we were able to monitor other countries and, of course, here in the United States on the spread of COVID-19. And what we also did, we established a Navajo Nation COVID-19 response team, healthcare professionals, leaders, and we started, coming together to discuss what's happening in other parts of the world with COVID-19. And as we saw it come to the United States in the northwestern part of this country, we began to mobilize our efforts, and get the Navajo people updated on what's going on in the world and the country, using social media, using the radio, the television as well, and just letting everybody know to be prepared as it spread throughout the country. Now, if the Navajo Nation were to be a state, we probably would have been the 48th state to get a COVID positive case. And I say that because all the states around us had COVID-19 in their jurisdiction before the Navajo Nation got its first case. So the Navajo people did a great job in pushing back and on the virus and following these protocols. But of course, if you're right in the middle of the pandemic, it'll creep in, and that's what happened on the Navajo Nation. And our response, just like the rest of the country, was quick, but there was so much uncertainty. We didn't know what we were dealing with. I know the country didn't know what they were dealing with. We even had lockdowns. We locked down our nation from visitors, but the 403,000 Navajo citizens, majority of them live off the Navajo Nation in other parts of the country and all over the world. And so we're not going to say no to our Navajo people from coming home. But that's one of the reasons for the spread here on Navajo Nation is people brought it back into within the 4 sacred mountains that that the Navajo Nation is within. And so we did our very best. As a sovereign nation, we were able to put in place our own protocols, 57-hour weekend curfews. We would lock down for the weekend. We would be out there giving out supplies to people that have been affected by the virus. And we did a mask mandate. Matter of fact, that mask mandate is still in place today. April of 2020 to today. And so we have taken this pandemic very seriously, and our citizens have done an outstanding job in following these protocols. And the rest of this country, there's pushback on wearing masks or being told to stay home. People are saying you're not going to take away our freedoms, but here on Navajo, it wasn't about individual freedoms. It was about a collective whole. We wore a mask not for ourselves. We wore a mask for our community, our families, and our nation. And I think that's a different outlook than some of the people throughout this country. It was about being a warrior. It was about fighting against COVID-19 and telling our young people to help our elders and people to stay home, and not just stay home in fear, but also to encourage them to teach our ways of life, teach our language, our culture. And many of our Navajo citizens took on that challenge, and there has been a renaissance of our, in learning about our ways and our language, and now that's being embraced in our schools. So just yesterday, we had a Navajo Nation Day of Prayer. This week marks 2 years since the virus has come onto the Navajo Nation. And we've lost 1,657 of our citizens to COVID-19, and we honored them. We remembered them yesterday in a day of prayer, and also praying for those who have still dealing with the long-term health issues from catching the virus. I think overall this has highlighted the resilience of our Navajo people. We've gone through some tough times as the first citizens of this country, and it just showed that we are able to come together as one people to help each other out. Early on, media attention nationally, internationally was on the Navajo Nation because of the per capita infection rate, but we turned that around. Well, today we are the most highly vaccinated people in this country. 75% of our people are fully vaccinated. 65 and over, our elders, over 80% fully vaccinated. So that our elders took this pandemic seriously. And we have mandates in place for our Navajo Nation employees. Over 90% of our Navajo Nation employees are fully vaccinated. And when I say fully vaccinated, that means 1, 2 shots or 1 J&J, and also the booster shots. And that's our definition of fully vaccinated. And this country has yet to redefine fully vaccinated individuals. And so, again, I cannot reiterate enough how the Navajo people have done excellent in combating COVID-19 throughout these 2 years, and just leading the people, serving the people has been inspiring to know that we were able to flip it around from the most infected area in the country to the most vaccinated. And just this last surge, our hospitals didn't get overrun, just like the rest of this country saw. And it's because of the mask mandates, these protocols that are put in place, and of course our high vaccination rate. Our death rate is very low. Of course, one death is one way too many, but compared to other jurisdictions, very, very low. And it's because of the Navajo people getting their vaccine and also following these protocols. And our Navajo people are seen wearing masks even in places where they don't mandate it. It's funny. One leader said to me that we know all the Navajos that are in Phoenix or Denver, Salt Lake, and large Native American populations because they're wearing masks, and even they don't have to wear it, but they choose to wear it because they want to keep their people safe, and because many of them come home on the weekends. And we, as you may know, Megan, we have a high percentage of people in that most vulnerable population category, and we just want to keep our people safe, and that's what the Navajo people have done thus far.
So thank you so much for just explaining the entire experience of the Navajo so far, and particularly the immense and great vaccination rates that you guys have been able to achieve across the Navajo people, and also the high compliance with wearing a mask across. Even I'm from Arizona, full disclosure, so I know that we haven't had really high mask mandates across the state, but obviously the Navajo people are wearing them even in Phoenix where it's not currently required. How do you think you as a government have been able to encourage and get these levels of compliance and convince people to get vaccines so well? Like, how has that played out within like a communication strategy or a public health strategy for you?
Mm-hmm. I think we took a different approach here on Navajo. We used our teaching, our culture, and our traditional teaching to encourage our people to be safe and to follow these protocols. There's a story in our culture about the hero twins coming to this earth to help protect the Navajo people, and they were given weapons and they were given armor to fight off monsters, and these monsters were called old age and hunger and poverty, lice. Lice, for example, just personal hygiene. And these are stories that have been handed down from generation to generation. And today, you fast forward to the 21st century, and we still have monsters, these modern day monsters: alcoholism, drug addiction, suicide, diabetes, and COVID-19. And we have the weapons and the armor to fight off this new monster. And wearing masks, getting your vaccination is a protection against this modern day monster, and framing it in that way. I think that is the reason why our elders took this pandemic very seriously, because they understood what we were dealing with. It was a new monster that was coming into the nation, and that's why you see very high vaccination rates, because we're warriors and we're going into battle against this new monster, and you got to be prepared. People were getting prepared by getting their shots and these weapons, masks, hand sanitizers, following the protocols, and utilizing our teaching really helped us in pushing back on COVID-19. Now, the rest of the country, they have done an outstanding job, and maybe the approach might have been a little bit different. They should have, I believe they should have stayed the course on some of these protocols. You know, of course, CDC will tell you, wear your mask, and then they'll say, take off your mask. And then another surge comes and they say, put it back on. Or they'll say, well, 6 feet social distancing, and then they go to 3 feet. You know, consistency is key. And that's why on Navajo, we said, we're not removing our masks just yet. And you need to be consistent. And I think, you know, with Dr. Fauci being on our show, on our town hall meetings, we had these town hall meetings every week, sometimes even 2 times a week, to get information out to our people about the updates and also what to do. We also invited public health experts. Dr. Fauci was on. Dr. Fauci applauded the Navajo people, and even went as far as supporting and saying that Navajo could be a case study, a model of how a region can push back on COVID-19. And then that's why I was saying, I mean, if everybody were to follow these simple healthcare or these health protocols throughout the country without wavering, without changing, just imagine how better off we would be. I don't think it's time to remove the masks, but other jurisdictions have done because of political pressure. But on Navajo, again, it's not just about our freedoms. It's about taking care of our elders. It's about keeping our children safe. That's how we're thinking here in indigenous communities. And so, you know, I think we all need to reevaluate, you know, how we think about our neighbors, our communities, and our families, and our country. Where I think not being individualistic, but to look at the greater, the good in protecting all citizens. Maybe if we all think that way all across the country, it would be different. Now, maybe we would be out of the pandemic. And that's just my opinion.
Well, I definitely agree. I think there are many lessons we can learn from how the Navajo have dealt with COVID-19. But one more question. Were there any unique issues that the Navajo faced different, you think, from the surrounding states or the Four Corner states that the Navajo Nation reservation lies on? Do you think that the Navajo faced any unique circumstances different, or did you have similar experiences as the other states surrounding you, would you say?
Well, on Navajo, we live in multi-generational homes. That's what we like, what we want. We live with our our elders. Maybe we may be living with our uncles and aunts, and there's a shortage, of course, in housing here on Navajo. But at the same time, we like to be in these multi-generational homes. So when someone comes in with COVID-19, you see the spread happening pretty quick early on, and it would take the whole household and then get sick. And so that was one how do you say this? It took advantage of our strength, this COVID-19. The other is water and electricity. 30% of our Navajo people don't have running water and electricity, but yet people are being told to wash your hands as periodically. And water is important to those, you know, that don't have the fortune, that are not fortunate, that are fortunate to turn on their faucet. You know, I still haul water back at where I grew up. You know, my family still don't have running water. I'm the president of the Navajo Nation, but we're such a rural nation that it takes millions of dollars to get water lines into the most rural parts of the nation. But we grew up hauling water, going to a source, maybe 30 miles away. So that's 60-mile round trip to get your water. So we conserve water. And when we bring it home, you know, we're taught that the water, you don't eat or you don't drink until your animals are fed and are given water. So that's just our priority of utilizing water. And then because they sustain life, our animals, we eat the produce. Then also if we have farms, water goes to the farms because that gives us life as well. You know, we utilize the produce for that. And then what's remaining goes to drinking water at the home. And whatever's left after that goes to personal hygiene. And sometimes you're not able to wash your hands every time you know, you're out and about. So that also caused an increase in cases on the Navajo Nation. Of course, you need electricity to pull water into other parts of the region, and electricity. And we're fortunate with the CARES Act and the American Rescue Plan Act fund, the infrastructure dollars to begin to focus on water, electricity, building homes for our Navajo people. But we didn't have that during this pandemic. So that was something that was unique to tribes, not just Navajo, but indigenous tribes throughout the country, that many off reservation folks probably didn't know about.
Well, I guess now the question is, what comes next? COVID-19 isn't over, but we are reaching kind of the tapering, at least how much of the country is dealing with COVID-19. What do you see as the next 6 months for you and for the Navajo Nation?
Well, infrastructure development, utilizing some of these dollars to get water to our people, electricity, broadband telecommunication. Broadband is needed to get information out to inform the public. Housing. So those dollars are coming in. So that's going to be taking up a lot of the next 6 months. And in response to COVID-19, you know, it's just continuing to educate our people on following these protocols. I understand there's going to be now another booster that may be available. That's 4 shots now, to encourage our people to get their shots and continue to keep their guard up. Mask mandates, I'm sure, will stay in place. And we're even looking at now possibly opening up larger events on the Navajo Nation. And we are looking at large gatherings to require your vaccination cards to enter into large gathering functions, or a negative test to be shown in order to go into larger gatherings, such as graduation and fairs. So we can do that as a sovereign nation, and I think people will be open to that, because, you know, we got hit hard, but we turned it around, and we just got to stay cautious. So I think that's the next 6 months for us, unless there's another big surge that may sweep the nation, and we're going to continue to monitor what's happening around the world and here in this country.
Well, on that note, thank you so much for participating in the How to End a Pandemic project. I appreciate your time and for all of your efforts.
All right. Thank you, Megan.
Thank you.